The most common reason for joint popping is the release of gas bubbles within the joint. Synovial fluid, which lubricates the joints, contains gases such as nitrogen and carbon dioxide. When you move a joint, the pressure within the joint changes, causing these gas bubbles to pop or snap. This is similar to the sound produced when you open a carbonated beverage. The movement of tendons and ligaments around joints can also cause popping sounds. These structures can sometimes snap or move over bony prominences when you change positions or perform certain movements. This is commonly experienced in the knee or shoulder joints. Structural irregularities within the joint, such as rough cartilage surfaces or small fragments of cartilage, can cause popping or grinding sensations. These irregularities may occur due to previous injuries, arthritis, or degenerative joint conditions. Individuals with hypermobile joints, where their joints move beyond the normal range of motion, may experience frequent joint popping. The ligaments supporting the joint may be looser, allowing for more movement and increased likelihood of popping sounds. Joint popping can be associated with arthritis, a condition characterized by inflammation and degeneration of the joints. In some cases, the popping sound may result from the roughened surfaces of the joint rubbing against each other due to cartilage damage. It's worth noting that joint popping is often harmless and doesn't necessarily indicate an underlying medical condition. However, if you experience pain, swelling, or a decrease in joint function along with the popping sounds, it's advisable to consult a healthcare professional for a proper evaluation and diagnosis. Thanks for watching. Quench more to create awareness and spread the knowledge.